One of the things I wish veterinary students maybe were a little more prepared for was how to become very good surgical assistants. A lot of veterinary students want to jump right into the operating room and become surgeons and start doing surgery themselves, but we have to be able to become great assistants before we can become surgeons. It's very simple. We have to be able to learn to crawl before we can walk. We need to learn what is the next step of each surgical procedure before we can really jump in and become a good surgeon.
The biggest challenge I'm having as a veterinary dermatologist is dealing with methicillin-resistant staph pseudodermatitis. And I believe it's because of the lack of respect of antibiotics and their impact on the microbiome. I think that veterinary students need to understand that every time they administer an antibiotic, they have to realize the impact they have on that animal, just not at that moment, but in the future. And also as it can affect bacteria that will then affect all the animals.
One of the biggest parts that I think I lacked in veterinary technician school was communication. Particularly, we did focus on communicating with clients and demonstrating and increasing compliance, but not so much about the interpersonal communication that will need to occur within the veterinary team, and truly understanding about who we are and who our personalities are, and then how those interact with the personalities around us.
I wish more veterinary schools had, and I may be partial, sports medicine and rehab departments. These are places where we can get practical application on managing what students as new graduates will see day in, day out, from spinal cord injuries, osteoarthritis, wound care. Where can we get these patients that are geriatric, moving better, ones that may not be able to go to specialists? So if more veterinary schools were teaching their students and had functional sports med and rehab departments, I think we would see a better case management and better students and better veterinarians coming forward into our field.